name is Sarah. This is my Cardio.MOV health assessment video. Hi, my name is Sarah. I'm going to be doing a Cardio.MOV health assessment on you, and I'm just going to provide for some privacy, and then we're going to get started with some health history. Okay, we're going to start with the lungs first. Do you have a cough?
No.
Have you ever had any shortness of breath or hard breathing?
No.
Any chest pain with breathing?
No.
Okay. History of respiratory infections such as asthma?
No.
COPD?
No.
Pneumonia?
No.
Okay. How many colds would you say you have a year?
1 or 2.
Okay. Do you smoke cigarettes or cigars?
No.
And what are the environmental conditions like? Where do you work?
I work in an office
And where do you live?
in the country
Okay. And when was your last TB skin test?
about 5 years ago.
Okay. And the results?
Negative.
Okay, good. You ever had pneumonia?
No.
Last flu vaccination?
Last week.
Okay, great. And now I'm just going to get started with the cardio health history, and then I'm going to wash my hands and do the physical exam. Do you have any chest pain or tightness?
No.
Any shortness of breath?
No.
How many pillows do you sleep on at night?
1.
Do you have a cough?
No.
Do you seem to tire easily?
No.
Have you ever noticed your facial area becoming a bluish tint?
No.
Okay. And do your feet or legs ever get swelling?
No.
Okay, good. And do you awaken at night with an urgent need to urinate?
No.
Okay. And you have a history of high blood pressure?
No.
Cholesterol?
No.
Heart murmur?
No.
Rheumatic fever?
No.
Okay, good. And any significant family history of cardio disease?
No.
And your diet?
Fish, chicken, steamed veggies, high fiber.
Okay. And your exercise?
Once or twice a week.
Okay. And do you drink alcohol?
Only socially.
Okay. And do you do recreational drugs?
No.
Smoke cigarettes?
No.
Okay. And I'm just going to wash my hands and then we'll get started with the physical exam. Okay. And now I'm just going to do the inspection stage where I'm looking at your chest wall versus symmetrical and your spine, which is symmetrical. And I'm noticing that your thoracic cage is symmetrical on both sides, and it's a downward sloping of the ribs, which is good. And I'm just going to look at your scapula and make sure they're symmetrical, and they are. And now I'm going to look at your anterior and posterior diameter, and it's less than your transverse with about a 1-to-2 ratio, which is good. And I'm going to notice that the quality of your respirations is even and unlabored. And your position for breathing is relaxed. Now I'm just going to look at your skin for any lesions. And I don't see any lesions. And your nails are not clubbing. Your lips are not cyanotic. And I'm just going to note that your facial expression is relaxed. Your level of consciousness is alert-oriented, and you're very cooperative. Now if you could just remove your shirt. And I'm going to put my hands on your chest, and I'm going to notice the symmetrical of your chest. You could just take a deep breath. Okay? Symmetric. And we're going to do the same thing to your back. Deep breath. Okay. And now I'm going to do tactile fermentus. I'm going to have you say 99 when I tell you to. I'm going to put my hand on your chest. Go ahead.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, great. Now I'm going to do the same thing on your back. If you could just say 99 again.
99. 99. 99. 99. 99, 99, 99, 99, 99.
Okay, great. And now I'm just going to palpate your carotid artery one at a time. Okay, and this one is strong with 2 plus strength. I'm going to go to the other side. And it is strong with 2 plus strength. So they're both equal bilaterally, which is good. And now if you could just lay down, I'm going to palpate for the pericardium. And I'm going to start at the apex, working my way to the left sternal border, up to the base of the heart. Okay, and I notice no other pulsations, no lift or no heave. Okay, and now if you could just, I'm going to do the apical impulse, which is the point of maximal impulse. And it's at the 5th intercostal space, mid-clavicular line. Okay, and there's no thrill. But I'm just going to ask you to exhale and hold. Okay? And now if you could just sit up for me. I'm going to percuss anterior and posteriorly. Okay, and I'm going to do the same thing on your back. Okay, great. And now we're just going to go on to the auscultation part of the examination, and I'm going to be using the diaphragm of the stethoscope to listen to your breath sounds, and I'm just going to have you take a deep breath for me whenever I'm moving along. Okay, great, and I heard no adventitious sounds, and it sounded normal. Now I'm just going to go to your back and do the same thing, and just take a deep breath. If you become tired, you can stop at any time. repetitious sounds, and everything sounded normal. Okay, and now I'm just going to auscultate your carotid artery using the bell of the stethoscope. And I'm going to start at the jawline and work my way to the mid-clavicle all the way down to the base of the neck. And if you could, just take a deep breath and exhale. And no bruit or swishing was heard, which is good. So now we're going to move on, and I'm going to auscultate your pericardium, and starting with the diaphragm of the stethoscope. And this is the point where S2 is heard. And this is the base of the heart, and it's dub. And this is the point where S1 is heard at the apex of the heart, and this is the love sound. Okay? And I heard no murmur, and it was sinus rhythm. Now I'm just going to listen again using the bell part of the stethoscope. Okay, and I heard no murmur and sinus rhythm. And now I'm just going to have you lie back down. And I'm going to account for your apical rate for a whole minute. Which is normal. Okay, you can just sit up now, and you can go ahead and put your shirt back on. This concludes our health assessment video of the cardio